everybody. Um, I probably kind of look a mess today because I haven't really did anything with myself today. I mowed the lawn earlier, and then a few of the grandkids came over for a little while, and I had a doctor appointment today for a blood draw, and tomorrow I get my immunotherapy treatment. And also, what I'd like to talk about is they want me to get a colonoscopy. About a year ago, um, they said I had colitis. I was in the hospital for a few days. I had got a milkshake from McDonald's, and what was strange was I went through the drive-through, and tell me in the comments below what you think about this, because I think that the colitis that I had was brought on by bacterial infection, because I went through the McDonald's drive-through and I thought, well, I'll get a milkshake. And they asked me in the drive-through, do you want this extra milkshake because somebody ordered it and then they didn't get it, and would you like to have it? And I said, no, um, I don't. I'll take, the fresh one. And I think they gave me the old one anyways, because when I got home, about 3 or 4 hours after I got home, I started throwing up, and then I had blood in my stool, and I had loose stool, and I was miserable. And it got worse and worse and worse. And I went out to the hospital, and then they done a CT scan, and I told them what happened, and they admitted me for a few days, and they said that I had colitis. Well, then they were talking about how, you know, maybe I needed to get a colonoscopy. Maybe it was, they kind of indicated it was a permanent colitis, like I'd already had it. And I don't think this is the case. Hang on a minute. There's a feral cat out there. Okay, Sammy. All right, it's all right. Come here. Come here. Yeah, he's barking at a cat. Come here. No, no. Come here. Come here. Come on. Come on. Come on. Come on, this way. Come on. He usually doesn't bark at them, but that one he hasn't seen before, so come here. No, no. Well, anyway, getting back to what I was saying. So sorry. Sammy, come here. Come here. Come here. Come here, okay? Come on. Well, anyway, getting back to what I was saying, I believe that colitis was brought on by bacteria from a bad milkshake. Well, then I found out recently, because I had a bout of what seemed like colitis again, and at first I thought, well, maybe I do have colitis. So I went to the doctor because I was having problems, and I found out I had E. coli. And I just got off of antibiotics for E. coli, and I think the E. coli is gone, but I went back for a recheck, and they sent my test results to a lab, so I should be getting those back here in about a week. So, yeah, that's going on. But now, since I went to my immunotherapy treatment, they wanted me to get, a colonoscopy, because they want to check to see if I've got, this colitis or not, which I'm not sure if I got colitis or not, but I don't think I do. I think that anybody can get colitis when there's a bacterial infection going on, like E. coli or, food poisoning. My screen is freezing. Sorry. But, yeah, anybody can get, colitis, you know, which is inflamed intestinal tract when they have a bacterial infection or E. coli. So, um, you know, there's temporary E. coli, and then there's, you know, E. coli that people have, you know, permanently too. But they said the only way to test for colitis is, you know, if you get a colonoscopy. But I don't want to get a colonoscopy because I'm debating, because I had a surgery that went bad several years ago where I was getting a hysterectomy, and the robot burned a hole in my bowel and in my colon area. And I had to have emergency surgery because I went septic. And now I'm very afraid to get a colonoscopy because um, I don't know, you know, if the benefit of getting it would, you know, outweigh the risk. And I don't know, you know, I mean, I don't think anything would go wrong, you know, because colonoscopies are performed, you know, on people that's had surgeries before and things like that in the past. But I'm just very nervous about it. So I'm debating if I should even get this or not done. And I may wait and see, you know, if I have another bout of colitis again, because I'm thinking that this colitis may have been brought on by the E. coli, which, you know, I could have ate, you know, some fruits or vegetables that may have had E. coli on it, um, and not knowing it, you know. I'm not for sure how I got E. coli, but there's different ways you can get it. But um, yeah, but anyway, I'm sure the E. coli's gone now, and I'm feeling much better. Now, as far as my dental goes, I'm not having any pain, but it just feels like this side of my upper gum is bigger than the rest of my gums. So, and it looks bigger too. So I'm not sure what's going on with that. Maybe it's the way the teeth were pulled. I'm thinking it's going to be something that I'm just going to have to get used to and live with, possibly. I will get an opinion about it in the near future, but I also have to make an eye appointment. And right now they're like 4 months behind on eye appointments. And when I called last week, they said that I would have to call back in another week or two. So, yeah, that's going on too. And my screen keeps freezing up, so I'm not sure how much, you know, people are seeing or hearing on this video. But yeah, that's what's been going on in the last few days. So